대부분 내빈과 연사분들께서 착석하신 것으로 보입니다. 오늘 이 자리에는 서포터즈 여러분들도 함께 자리해주고 계신데요. 오늘 연사 그리고 서포터즈 여러분 모두를 모시고 기념사진 촬영 먼저 하고 시작할까 하거든요. 어떠세요? 네, 좋습니다. 네, 그럼 저희가
We'd like to have the group photo session with our supporters if you agree. So, saying yes, we would like to now invite our guest of speakers. We have Dr. Shin Jae-soo and Mr. Yoon Tae-kyu from the Ministry of Health and Welfare taking their valuable time. So with them in the center, we'd like to invite all the people to take the group photo.
네, 저희 서포터즈 여러분들
I'd like to ask all the supporters who are here today to come to the podium to take the pictures. We'd like to ask you to face the cameraman so that all of you can be taken in one picture.
네, 저희 서포터즈 여러분들께서는 한 카메라 앵글에 다 담길 수 있도록 무대 위쪽으로 올라가 주시면 감사하겠습니다. 아마 여러분 이틀 동안 함께 하시면서 모르는 사람이었더라도 이제 눈에 좀 익으셨을 것 같아요. 그러니까 좀 붙어주세요. 네. Okay, please come closer to each other. We don't bite you. 네. 조금 더 가까이 서주시면 좋을 것 같고요. 네. 어떨까요? 카메라 앵글에. 네. 그쵸. 학생 여러분 이렇게 앞머리도 좀 만지고 네. 예쁘게 나올 수 있도록. 네, 좋습니다. 그럼 여러분, 네, 여기 카메라 봐주시고요. 너무 예뻐요. 네, 예쁘게 잘 나오고 있어요. 찍겠습니다. 3, 2, 1, smile. 네. Make sure not to close your eyes. 여러분, 눈 감으시면 안 돼요. 눈 크게 뜨시고. Keep your eyes open. 네, 눈 크게 뜨고 다시 가겠습니다. 3, 2, 1, smile. 그다음에 네, 어제도 계속했던 포즈 있죠? We do this pose every time. Thank you. 찍겠습니다. 3, 2, 1. 네, one more. One last shot. 네, 그러면 이번에는 우리 Korean Heart 해볼까요? 고맙습니다. 감사합니다. 좋아요. 3, 2, 1. We would like to. 네, 네 마지막으로 저희 좀 늦게 오신 분이 계세요. 이 잔치에 한 명도 빠뜨리고 찍을 수는 없으니까 모두 다 담아서 다시 한번 찍을게요. 네, 제일 뒤에 계신 학생분들 어깨 사이로 본인 얼굴 잘 나올 수 있도록 이렇게 좀 조정 좀 해주세요. 네, 좋습니다. Thank you. 네, 다시 한번 가겠습니다. 3, 2, 1. 네, 저희가 한 명 더 왔으니까 다시 한번 repeat. 3, 2, 1. 네, 좋습니다. 감사합니다. Thank you very much for your cooperation. 사진 촬영에 협조해 주셔서 감사합니다. 네, 여러분 착석하시는 동안 심포지움 만족도 조사에 대한 안내 말씀 다시 한번 드리겠습니다. 오늘 현장에 계신 참석자분들을 대상으로 심포지움 만족도 조사
We're also conducting a satisfaction survey here on site. We'd love to hear from you so that we can make next year's symposium even better. If you are on site, please scan your mobile QR code to access the satisfaction survey page. And the first 100 people to complete the survey will receive a free gift. We'd love to hear your feedback about the symposium so that we can be improving ourselves.
네, 그럼 본격적인 이틀차
With that, I would like to open the second day of the symposium. Ladies and gentlemen, I would like to introduce myself once again. My name is An Eun-bin, your moderator again this day. Thank you very much for coming early in the morning like this to grace this event. Before we start, I'd like to make also guidance about the safety measures. If you have any symptoms of COVID-19, such as fever, cough, or chills, please do not hesitate to reach out to our staff members or security members for assistance.
fever, cough, or chills, do not hesitate to reach out to our staff member for an assistance. The 2024 International Symposium on Traditional Medicine is committed to ensuring the safety and well-being of all participants. 네, 오늘은 세션 3와 4가
Today we have session number 3 and 4 consecutively, so this is the opening of the second day.
the session 3. 오늘 발표해 주실 발표자분들께서는 원활한 세션 운영을
We ask the presenters to keep their talks to 20 minutes or less to keep the session running smoothly throughout the day today.
오늘 역시 다양한 발표가 연속해서 이어질 예정입니다. 그래서 질문은 각 세션의 모든 발표가 끝난 후 질의응답 시간을 통해 일괄적으로 받도록 하겠습니다. Today's session will be also a series of back-to-back presentations, so the question will be answered after each session. 네, 그럼 첫 번째 발표자 모시겠습니다. 오늘 첫 번째 발표는 Pathway for NCC AOM Board Certification Overview라는 제목으로 미국 NCC AOM 이사회 전임 의장이시자 워싱턴 대학교 어셔 센터 센터장이신 이만 마지드 교수님께서 맡아주시겠습니다. Ladies and gentlemen, we are honored to commence Day 2, Session 3 with a distinguished speaker. Please join me in welcoming Dr. Iman Majid, the immediate past chair of the National Certification Commission for Acupuncture and Oriental Medicine and director of Osher Center at University of Washington. 여러분 큰 박수로 센터장님 모시겠습니다.
Good morning, everybody. My name is Iman Majd. I'm a physician and also a licensed acupuncturist in integrative medicine. Before I start, I would like to thank our organizers for this very esteemed symposium, the Ministry of Health and Welfare, our colleagues at NICOM, and also our colleagues at ESCOM It's an honor to be here, to be invited to present on behalf of the NCCOM and also University of Washington. In the past couple years, I've learned a lot about Korean medicine and the advances in Korean medicine. I think that there's a lot of room for you guys to be very proud of what you have achieved. You have really taken this body of knowledge to a different level. You have bettered it, and I wish all of you success in the right path that you have, and I wait to hear more successes in the near future. It has been very impressive to be here, and I hope that I'll have another chance in 3-4 years to come back to Korea and witness your successes again. Before I start talking about NCCOM and the pathway that we have created in certification in the United States, I would like to talk a little bit about regulations in US. In the US, professions are self-regulated. What it means that the government does not have any saying in how to regulate a profession. It's up to the profession that they come up with the standards to regulate it themselves. So for the profession of acupuncture and acupuncturists, this is something that started about 40 years ago. Acupuncture is a new profession in the United States. It started about 50 years ago in 1970s. And it has gone through a lot of different iterations of regulations. They have been different organizations that they had ebbs and flows, up and down. But one organization has been very consistent, and that has been NCCAOM, that I will talk a little bit about it. And this is the organization that comes up with the standards for certification, meaning that there's a national board exam that every acupuncturist, after they finish their studies, they have to go through this exam. They have to sit for the exam, and they become board certified before they can obtain a license. This does not apply to the state of California. California is completely different, and they have their own board exam, but it's not a national exam. So my presentation will be focused on acupuncture herbal medicine practice in the United States. What is NCCAOM? Requirement to practice in the US, NCCOM and UK pathway, which is the main topic or the meat of this presentation, so to speak, and benefits of being NCCOM certified, and I'll be happy to answer questions after. First, we picked the term acupuncture and herbal medicine, but the organization is NCCAOM, National Certification Commission for Acupuncture and Oriental Medicine. The term Oriental in the United States has become a little bit political, and we are not allowed to use the term Oriental, but we haven't changed the name of the organization yet. So you won't be hearing the term Oriental in US soon. Right now, we are referring to acupuncture and herbal medicine. These are the countries that have NCCOM board certified acupuncturists, and as you can see, we have about 21,000 acupuncture practitioners across the globe that have been certified and board certified through NCCOM. This is a map of United States. As you can see, this is California, and California, as I mentioned, they have their own board exam, which is not a national exam, but then the rest of the country, they follow the NCCOM National Board Exam. Pretty much in a majority, I can say easily like 47 states, now they have gone to the point that they need national certification before they present a license for practice. It may not necessarily be the full certification, but it might be some form of qualification through NCCOM. The practice of acupuncture and organizations who are involved in acupuncture business in the US are a little bit complex. I go very slowly here so you can follow and have a better understanding how it works. So we have the legislators at the state level. Each state has its own legislation. So if you get a license to practice in Washington State, where I am from, that license means nothing to practice acupuncture in the state of Texas. So you have to go through the Texas licensing again. This is very difficult. It is very challenging. We have been trying to work with the federal government to recognize a unified license that goes beyond the borders. But this is not unique for acupuncture. As a physician, if I move out of Washington state and I go to Texas, I have to get a license to practice medicine in Texas. So each state is very independent and they have their own rules and regulations. On the right hand or left hand side, sorry, here, you can see these are the membership organizations that we have. At the state level, we have the state associations, and the state associations, they all become part of ASA. ASA is American Society of Acupuncturists. It's a consortium of state associations. So it's a membership organization. Then we have ACAM. ACAM is the body that comes up with the curriculum for schools, how to teach acupuncture. This curriculum does not bring any mandate with it. What it means that you can have the curriculum, you can present it to the schools, but there is no obligation from schools that they have to teach the curriculum in their schools. There are some core competencies as part of the curriculum that most schools adhere to, but then they have some variations in different curriculum. So this is the beauty and the difficulty. The beauty because like Chinese medicine or East Asian medicine, it's very diverse. We have Japanese style, we have Korean style, we have Chinese style, Vietnamese style, and they have all contributed into this body of knowledge. So diversity is the beauty of it. But at the same time, it creates complexity. Why? Because when you graduate from one school and then you want to practice, the legislator doesn't know what you know and doesn't know what you don't know. You could be from a Korean school, or you could be from a TCM school, like I'm from a TCM school at Bastyr University in Seattle, and they don't know what means what. So the only thing that the legislator rely on is the NCCM National Board exam, because that's the only unifying factor. Everybody gets the same questions and they have to go through the same exam. On this side, we have the NCCOM, that is the testing and the certification organization, and we have to maintain our certification. Every 4 to 5 years, we have to recertify. Like working in a hospital, in my center, you cannot continue working in academia without being recertified. So every 4 years, like a board certification in medicine, you have to get recertified. Then we advocate and lobby with the state regulators, and then it goes to the state legislators, and eventually goes up to the federal government. What we have been seeing is there has been an increase in demand for acupuncture services. Pretty much in all major academic centers and hospitals, they're using acupuncture. And there's a shortage. There's a shortage for acupuncturists to come to the system. The reason for it is that the education of acupuncture has been separate from mainstream. We have the conventional medicine, and acupuncture was under the umbrella of non-conventional medicine. So we have these graduates that are in a non-conventional system, and then we want to bring them into a conventional model, which makes it very difficult for the system to work with them. So as a result, we have come up with these ideas that how we can fill the gap of knowledge and the skill sets for acupuncturists and equip them in a better way so they can work in a academic center. In my center at the University of Washington, you're seeing more and more demand for acupuncturists. It is a good thing, but at the same time it's a bad thing. Like for now, if we have a new patient that wants to see my acupuncturist in my team, they have to wait for 6-7 months before they can actually have an appointment with an acupuncturist. About 50% of the hospitals across the United States are offering complementary medicine. Most of them is acupuncture for pain management. And acupuncture has been one of the top 6 modalities in both outpatient and inpatient settings. Something about inpatient setting that's different from Korea and other countries. The work that we do in United States need to be captured by insurance, meaning insurance has to pay for it. And that is a little bit of challenge because as of now, insurance companies do not pay for inpatient acupuncture. So if I go in for example, in post-op and after the surgery, go to post-op section and do a treatment on a patient, that cannot be captured and nobody is going to pay for it. So unless there's through a grant. But there's subsidies that can cover it, but for outpatient, it's billable and it will be covered through insurance. This is NCCOM. Sorry, I'll go back. The mission for NCCOM is primarily creating safety net for the practice of acupuncture. I did mention that education of acupuncture is very diverse. The training is very diverse in the United States. In California, we have schools that are based on Korean medicine, and the rest of the country, they're based on TCM and such and such. So the only factor that we can rely on, making sure that everybody has the basics skill sets to come and safely practice acupuncture is through NCCOM. So the safety of the public is a priority through NCCOM. The public safety, state reliance on NCCOM for certification for licensure, professional ethics and disciplinary review. If there's a complaint against one of the providers, it will report it to NCCOM and their certification will be revoked. And continued competency through maintenance of certification. Requirements for practicing in United States. To get a license to practice as an acupuncturist in the United States, one needs to go to school, an accredited school. We have about 47 schools in the United States that now are accredited, and education through those schools is accepted by the federal government. After you finish a 3, 4, 5 years program, either it's a master's degree or doctorate degree, then they sit for the board exam, and after they pass for the board exam, they can apply to get a state licensure. This is typically for somebody who has worked and graduated in US. What about foreign nationals? We can skip this one. We already covered this. And sorry, I think I'm missing a slide here. Oh, this is international. So this, for the international applicants, we created this pathway that, for example, somebody wanted to move from Korea, come to US and practice medicine. They had to present every single document, what the education they had, and NCCM had to review it through a third party and then approve it that yes, you have enough education, and now then you have, as an individual, you have to do this amount of training or go back to school and this number of hours of training, and then you become qualified for board certification. So it was really individual dependent. We wanted to move away from this individual dependent and create a pathway that makes it easier for individuals from different countries to actually become board certified. So that's why I started creating this global reciprocity. Reciprocity means dual, recognizing each other. So I have the honor of being the chair of this global initiatives, and we worked on these initiatives for many years. The first one that we had was with UK. Our colleagues in UK reached out and they wanted to see what we can do to allow UK acupuncturists to move to US and get a license. And we had people in the US who wanted to move to UK and practice acupuncture. So we did a gap analysis. We call it a catwalk or a gap analysis. So what it happens is that you look at the education in UK and UK looks at the education in US, and we try to understand what is missing in this education. For me, if I want to move to UK, what do I need to do? What are the areas that I need to gain more competency to become qualified to practice in UK? And same with somebody coming from UK. So we successfully finished this pathway, and it's been working really well. We have many practitioners now from UK who are interested in coming to US. So they get reviewed by NCCOM. And because they're coming as a UK graduate, it's not an individual case. We already know that what they need to have, what they need to do to fill the gap, and then they become eligible to sit for the board exam, become board certified, and get a license. And same with the US going to UK. The second country that we are working with now is Israel. And then we have other countries, Portugal and Australia should be here, and we have European TCM Association having this conversation with us. Our friends in UAE, I believe there was a point that they were interested in reciprocity. I don't know if it's still moving forward or not. And Canada. So there are some countries that they are interested in reciprocity. Now, in regards to Korean practitioners, I think it could potentially be a pathway of expanded traditional Korean medicine and Korean medicine in US by following this path, that having this gap analysis between NCCOM and the Korean Acupuncture Association to see where the gap is and what needs to be filled in case that providers want to move from Korea to United States, how they can become board certified and practice in the US, which I personally think it's an excellent move to help having more Korean medicine practitioners in the US. These are some benefits of being an NCCM board certified. You have access to many resources that NCCM is providing. NCCM is not a membership organization. The fees are through paying for the certification and recertification, but it brings a lot of benefits with it when you become a member or you become board certified by the NCCOM. And that was my presentation about the pathway becoming eligible to sit for the NCCM board exam and hopefully getting a license in the US. Thank you.
Thank you very much. Thank you, Dr. Iman Majid, for the informative presentation. And we're going to take the question at the end of the session. So if you may have some question, please hold a question at the end of the session. Thank you very much. 네, 여러분 다시 한번 큰 박수 부탁드리겠습니다.
Once again, please join me in giving him a big hand. Thank you very much. And moving on, I'd like to now invite our professional coming from Abu Dhabi, UAE. So we have Ms. Laila Al Zubaidi, Director of Healthcare Workforce Licensing and Medical Education from DOH, Department of Health, Abu Dhabi.
Healthcare Workforce Licensing and Medical Education Division of Department of Health in Abu Dhabi. Ladies and gentlemen, please make another big round of applause. 여러분 다시 한번 큰 박수 부탁드립니다.
Hello, good morning. At first, I want to extend my gratefulness to the NICAM and the organizers of this event. It has been extremely exciting and also educational. There's a lot of information that I've grasped in these couple of days. Thank you so much. So my name is Leila Al-Zubaidi. I am the Division Director of Healthcare Workforce in the Department of Health from the United Arab Emirates, particularly from Abu Dhabi. Abu Dhabi is the capital city of United Arab Emirates. Through my slides, I'll be taking you through, this is what Abu Dhabi looks like. So I'll be taking you through what the Department of Health role is, what we do in terms of regulations. So the Department of Health is the health regulator of healthcare sectors in the Emirate of Abu Dhabi. I'll be talking to you about what we do in terms of traditional and complementary medicine, our history, what we have done, and where we're proceeding towards that perspective. I'll talk about regulatory frameworks and innovations in healthcare and some of our strategies. So, as you see here, the Department of Health is in charge of shaping the healthcare system in the Emirate of Abu Dhabi. We are well intervened within the regulations, we establish the policies, we monitor and are highly engaged with our healthcare facilities, unlike the US, where there are some spectrums that are left up to the healthcare practitioners to like self-regulate. In Abu Dhabi, we formulate the framework of policies and we establish our standards whereby healthcare practitioners, healthcare providers are mandated to ensure that they are practicing within the spectrum of the standards and policies. There is, of course, a room where within the spectrums and beyond the spectrums, that is within the safe practice, and innovation are permitted to be practiced by the healthcare providers. In my next slides, there will be more clarity of what my statements are. So in particular, we determine the capacity need of healthcare facilities. Which facilities and what services that Abu Dhabi needs or that the United Arab Emirates needs, we define that as regulators so that we do not have congested services in a particular area, for example, dentistry in a certain area. We have the framework of managing and controlling, so we ensure that patient and community accessibility to these services are all over the geographical distribution. Of course, our standards are in all different aspects, including medical education, accreditation are a mandate in all the curriculums and all the postgraduate medical education programs. And in addition to assessing and monitoring the healthcare providers' practice and performance based on our established standards and policies. So we do monitor to make sure that the healthcare providers and healthcare systems are aligned with the regulatory standards per the missions and the visions of what the government wants. So we are aligned and ensuring that these are successfully achieved. And of course, we incentivize the academic institutions to introduce healthcare sciences programs, medical education programs, scientific and research programs. We reinforce the structured curriculums resulting in high competent homegrown. That means that we ensure that we're not only extracting healthcare workforce from abroad, we are also building our own UAE national homegrown based on our tailored curriculums within the United Arab Emirates with the support of the regulatory authorities in addition to the academic authorities. The Department of Health also enables the clinical research program. So we set the standards, we set the policies, and we enable these to be into being. So implementation is very important according to the government requirements. So we ensure that we enable the clinical research programs in academic institutions and clinical institutions, as well as innovations in healthcare delivery to patient-centered care. So Abu Dhabi makes sure that that care is up to that level of standard. We also manage and monitor and observe the clinical practice in terms of malpractice, in terms of the level of care that the Department of Health requires. In here, I'm explaining, referring to the previous slide, the geographical distribution of healthcare. So the insurance healthcare network, sorry. So the health insurance network approvals are from the Department of Health. So this translates what I had mentioned. For instance, if we have a zone of dentistry healthcare in a certain place, and then we have an investor who wants to open another dentistry healthcare, and that area is congested with so many dentistry clinics, then the Department of Health will say, feel free to open your clinic, but that may be a loss, and we will not enroll you into the network of insurance. That is because we want to minimize the excess dentistry healthcare in certain areas, and to encourage that the healthcare, like I mentioned, are distributed all over the geographical areas. In addition, the government-owned properties for investments are provided to investors, and they are defined with the services that we want. For example, if we do not have enough mental health for pediatrics as a subspecialty, the Department of Health will say, okay, we're providing this area with this building. Any investor who is happy and capable to provide those services, these are the conditions, then healthcare investors can come and contribute towards providing the healthcare service in particular as per the Department of Health needs. The services, adequate settings, so we ensure that the healthcare facilities are also well equipped according to the healthcare services. Relevant licensed equipments that would be settled in those healthcare facilities in particular, in addition to safely measured assurance of healthcare to be delivered in those in those healthcare facilities. In terms of workforce, the healthcare, the Department of Health ensures that workforce have proper academic background. They're well trained, well knowledgeable, and have the accredited qualification backgrounds with specific defined requirements and criteria in terms of qualifications, in addition to the competency assessments. So prior to practicing in Abu Dhabi, healthcare professionals will have to be assessed to ensure that the competences meet certain standards and skills as set by the regulatory authority. In addition to the CME and CPDs and monitoring and enhancements of these standards should be maintained on annual basis. So there are renewal of license requirements in terms of CMEs and CPDs. Yeah. So what you see in this side, I'm sorry. I think this is the pointer. So this side here are the more details on the other side of requirements. So in this side here, I'm talking about the traditional and complementary medicine in Abu Dhabi. Ever since 630s, the Arab world have practiced traditional complementary medicine, but in a different state, where the Prophet in Islamic religion recommended highly the cupping practice in societies. So these were recognized ever since 630 years. In 650s, also traditional medicine have been available, and there are also numerous books that were published within these spectrums. In 1943, in the United Arab Emirates, we had the first allopathy medical clinic inaugurated in the UAE. That also developed and reached to a certain stage. And in 1996, we had the first Zaid Herbal Medicine Center and Research, also evidence-based studies with laboratory practice established in the United Arab Emirates, in Abu Dhabi in particular. This was then, I'd say, neglected a little bit, unfortunately, but now we're re-innovating the center. In 1996, traditional and complementary clinic affiliated with the research of ethnobotany, Department of cytochemistry department, microbiology, pharmacology department, including animal house, botanical garden, were established and were in practice. And then in 2009, we started the symposiums, conferences within the traditional and complementary medicine. In 2024 now, we're talking about more care and more focus by the Department of Health and the government of Abu Dhabi in traditional and complementary medicine. So we're looking into more focus in community well-being, personalized genomic medical care programs that we're working on, intent in mental health care, and we're reaching out to the community to provide services at home, online services as well. And we are focusing on longevity, functional medicine, integrative medicine, and curative and effective medicine. Abu Dhabi and the UAE continues to entertain traditional and complementary practice. We've had our ongoing innovative projects and expansions as we speak today. There's so many projects ongoing and we're still working on them. In here, it is almost the same on my left diagram. It is almost what I've mentioned. We are focusing on pharmacovigilance and drug education. So we have online educational links where you get all the information. We also have hotlines to respond to the community on any inquiries that may be required or clarifications. We are also working on drug and complementary medicine safety. Talking about drug and complementary medicine, as we speak, the Department of Health is highly comprehensive and integrated in terms of healthcare. To explain this further, we have all professionals working in the Emirate of Abu Dhabi are registered and affiliated in healthcare facilities. These are registered in our health insurance, so we can monitor and observe every medicine that is being prescribed by each doctor from which facility and to which patient. All that information is recorded in patients' unified electronic records. So we have electronic record for each patient, full profile with all the information. We're also encouraging research programs, and on this side, these are our traditional and complementary medicine publications. The Encyclopedia of Medical Plants of UAE, these are the plants that are grown in the UAE per se. So we may be a desert described type of climate, but we do have plants in the UAE. And this was published in 2017. So this was the first version of its kind, and we have another version that was published later on. It was 2020, version 1 and version 2. You'll find both in these links down here. I would really love to show you. I'm not sure if this is a touch screen. It isn't. I would love to show you the information that is included in this encyclopedia. If you click on it, you will see the different types of plants, the compounds that are in those plants, how they are used, how safety they are, and and how they're utilized. This is very important information. I would highly encourage that you have a look into these links. Otherwise, in my last page, you will also find our website where you can also find more information. So these are the traditional and complementary medicine professions that are regulated in the UAE for now. However, we are also including more titles that are not mentioned here. And I'm a part of the PQR, which is Professional Qualification Requirements member, and I'm working towards increasing more. And I've learned so much from these sessions, and I've seen that there are a lot of room that can be developed and improved. So I'm taking that knowledge back home, and I'll be including more titles within the traditional and complementary medicine. So in this slide here, I'll be talking more about the workforce strategy development and implementation based on the set framework by the regulatory authority. So in terms of faculty, they should meet the standards of academicians to deliver the educational programs. We do have standards and policies and requirements for any professional to deliver any educational models. There's no such a thing as claiming that you're an academician unless you have met certain requirements and identified by the health regulator. And the reason why you might see that there is so much requirements and comprehensive standards and policies, that is because Abu Dhabi is very attractive, and we have people coming from 200 different diversity worldwide. So there's no room for, like ambiguous information or violations, or everything is well structured and well trained. In terms of curriculums, there are curriculums that are also reviewed by the health regulator to ensure that the curriculums are also meeting the minimum standard requirements per the competency levels of each specialty that is required by the Department of Health. Education and training, knowledge of practice, practice-based learning, that's the type of education models that Department of Health encourages to be delivered in our institutions. Personal and professional development as well. In terms of research stimulation, the Department of Health encourages that any new curriculum that is being introduced in our academic institutions have research programs included. In terms of practice and practitioners, our licensed healthcare professionals, they are monitored, they're observed. We have ad hoc visits in the healthcare facilities, in healthcare providers, to ensure that the standards are at the safe measurements. And of course, to ensure that there is effective treatment where patients are getting curative treatments. Our professionals also are encouraged to continue practicing, not to have gap of practice. So the gap of practice, when there is interruption of healthcare professionals' practice, we encourage that they undergo clinical training and then assessments after that. So we ensure that the competency levels are met. CME accreditation and professional development and upskilling programs can be delivered. The Department of Health is also enabling the healthcare workforce to ensure that the competencies are met. So we do provide free upskilling and reskilling programs to our healthcare professionals. In particular, for instance, if there is an acupuncture new program or new competencies or new research studies, the Department of Health may offer those programs free of charge to our acupuncturists that are licensed in Abu Dhabi, to ensure that they are up to date with the knowledge and skills. And of course, that is all to make sure that safe practice is away from malpractice. This is another picture of Abu Dhabi that I've included last night to make sure that we know what Abu Dhabi looks like. It's a very beautiful country. However, with regards to healthcare strategies, as you can see, and as I have mentioned, we have high strategies, we have visions, we have missions within healthcare workforce to ensure that we are producing agile workforce, so there is sustainability within healthcare. And these are a few of our strategies that we have built. So we have Center of Excellence facilities. The Center of Excellence facilities, the Department of Health is working very closely with our healthcare providers to encourage them to be recognized by the Department of Health as excellence of healthcare. For instance, we have cancer centers of oncology centers. The setting is completely oncology with highly equipped medical equipments and highly equipped professionals in delivering oncology treatments to our patients through research, evidence-based and scientific research studies. We also have the organ donation program in the Department of Health. The majority of those working in healthcare sectors have contributed into the organ donation program. There is a lot of high success. If you go to our website, you'll find a lot of information, very interesting. We have the genome program. I think we are leading the world, or maybe we're the second internationally in the genome program, where Alway National Personalized Medicine are being introduced. We also have a Muasher system. This is very interesting. The Muasher system is a system whereby we are ranking healthcare providers to have them compete against each other with their services, level of services. So we have a criteria set in the Muasher system. So if a so we have, for example, Cleveland Clinic in Abu Dhabi. We have the other different hospitals like Tawam Hospital. We have Sheikh Khalifa Medical City, and many others. So Muasher, we set the standard and the criteria for healthcare providers to meet. Those who meet certain criteria be recognized by the healthcare providers to be number 1 or 1 star, 2 stars, 3 stars, 4 stars, 5 stars. Last year we had the Tawam Hospital, which is the oncology clinic, stand number 2. We have the clinic, Cleveland Clinic of Abu Dhabi, stand number 1. That is based on the best professionals in terms of qualifications, least malpractice and complaints against those facilities, the best equipments in those facilities, and many different data sets that are set there to assess the healthcare provision to the community. The last one here is the Malafi. Malafi is a project that worked and was established back in 2019, or I'm sorry, 2018. The Malafi system is a unified healthcare electronic records for the community of Abu Dhabi. So wherever you go, you will have your records in the system accessed by your professionals or by any professional in the Emirate of Abu Dhabi and also in the UAE. So if I had an X-ray or an MRI done 2 weeks ago, doctors are not permitted to abuse the system and request for another MRI to be done. That is harmful. For that reason, they have to refer back to the previously conducted MRI for diagnosis of the patient. So this is what we have achieved, one of the other items. On my left here, we also have other programs that are strategically, these are already achieved. These are not new programs. These are already achieved, and they're also, of course, in a state of redeveloping and enhancements. One of an interesting thing that I would like to mention, one of the achievements of the Department of Health, we have, since we have, like I mentioned, comprehensive records of patients and integrated records of healthcare providers and healthcare professionals, we can tell which physician has prescribed which drug. For example, narcotic drugs, for example, we can tell which doctor is prescribing which number of narcotic drugs to which patients. So that makes us in a very safe environment, so these types of drugs are not abused by healthcare providers. And that's it from me. And thank you so much. I hope you have enjoyed the slides, and I'm happy to respond to any questions.
Thank you very much. 여러분 큰 박수 부탁드립니다.
Thank you very much. Please join me in giving her a big hand. We were able to listen to the traditional and complementary medicines in Abu Dhabi and their current status.
네, 그러면 세 번째 강의로 넘어가 보겠습니다. 세 번째 강의는 Towards the Healthiest and Safest Region이라는 제목으로 한의사이자 세계보건기구 서태평양 사무처 전통의학 기술관으로 근무하고 계신 한은경 박사님께서 전해주시겠습니다. Ladies and gentlemen, for our third lecture in the session, Dr. Eun-kyung Han, Technical Officer at World Health Organization Regional Office for the Western Pacific, will be presenting on the topic of Toward the Healthiest and Safest Region. Ladies and gentlemen, please give a big round of applause. 여러분 큰 박수 부탁드립니다.
네, 안녕하십니까.
So good morning. As introduced, my name is Han Eun-kyung, and I would like to express my gratitude to the Ministry of Health and Welfare, NICOM, for organizing this great event. I would like to briefly introduce my organization and myself in English, but then I'll switch to Korean for the rest of the presentation.
Coming, and thank you for this opportunity to briefly introduce what the WHO's activities are regarding the role of traditional medicine in the Western Pacific region. I am In Kyung Han. I'm a technical officer for traditional medicine and the essential medicine and health technologies unit under the Division of Health Systems and Services, WHO Western Pacific Regional Office. 제가 지금 설명드린 DHS라는
So the DHS, the organization that I belong to, this is to manage the health system. So when it said the health system, it refers to the real world environment. So despite the long-term investment, still the effect or the performance could not be realized in a short-term period. But despite that, a lot of governments across the world, they are trying to bolster and strengthen their health systems, and they're making enormous efforts. So collecting all these efforts, and in order to provide a collective support for these government support, government efforts, WHO, WPRO provides various assistance. And for my presentation today, as a technical officer, I would like to focus my presentation on the traditional medicine and how WHO supports that. So before I talk about the main part,
Pacific region 여기에서 보시면
so to the north there is Mongolia, and also to the south there is Australia and New Zealand. So these are the countries that we cover. So we have 37 countries and areas within this region. So for example, like the American Samoa, it's part of the U.S., and Hong Kong and Macau, they are part of the China. So taking these into consideration, so that's why we put countries and areas to refer to the coverage of our geographic coverage of organization. So here you can see that the Korea, China, Japan are included, and also the Macau, Laos, Cambodia, Vietnam, Philippines, Malaysia. They're all part of the West Pacific region. And to the south, so there are many island countries in the Pacific Oceans. The largest one by size, I think, is the Papua New Guinea. And also there is a small island called Pecan Island. And the total population is only 50 in this country. So this is maybe the one of the smallest island in the world. And if you go to this island nation, and if you go to our website, the countries that we cover, they are listed in the alphabetical order. So starting from the American Samoa down to countries like this. So as you could see, if you look at the global map, actually the WHO covers various nations across the world. And in fact, these countries are all different in terms of the health system, culture, or the societal landscapes. So there is a lot of complexity and diversity being involved. But despite that, the reason that we categorize these countries as the Western Pacific region, so we group them into one category, and we define the common values that the countries in the same category should pursue for mutual growth, rather than the arbitrary growth or kind of top-down system structure. We don't really pursue these kind of things. Rather, what we pursue is the mutually beneficial growth that could ensure all member countries could prosper. So the reason why we are here today, why we don't work alone,
in order to find out the questions regarding that. I understand there are many researches, and at WHO, we do have the concept of universal health coverage. So this refers to the vision of WHO for that common co-prosperity. So Korea, we are very used to the concept of the universal health coverage, and almost all Korean population are enjoying the strong health services. But that's not the case for all countries. So universal health coverage is still a very stretched goal that will take time for some countries. For some countries, maybe they are very close to the goal of the UHC, but details should be worked out. So in order to achieve this UHC vision, WHO has come up with this paper. And the paper was written by Dr. Park Yuri in Lao PDR. And she talked about the integrated care. So integrated care refers to the traditional medicine, which is different from the conventional medicine or the biomedicine. But the traditional medicine should be integrated as a part of the mainstream medicine. So that's what we call integrated care. So integrated care is needed to achieve UHC to provide better health benefits to everyone. If you look at the box in the middle, here you can see the healthcare architecture. And under that, for the healthcare delivery service, there is a section for workforces and service standards and health information. In other words, to make sure everybody has a sufficient amount of the health information to make informed choices. So this is what this table highlights. And also countries do have different situations, and therefore we have to have a reciprocal, mutual system, and also through contextual fact by working on these contextual factors, we can achieve the UHC. So for traditional medicine, in order to make contribution to UHC, they should be part of the mainstream medicine through the integrated care. Next is about the regional vision that the WHO WPRO produces. So we have a Dr. Saya, who is a new head of our office, and our vision, I think, will be updated to reflect his new vision. So currently, the documentation is now underway in order to produce some new vision for the next 3 to 4 decades. So it has not been finalized yet. It's still a draft version, but here you can see the for the future towards the healthiest and safety regions. And to be more specific, this is about strengthening quality of TNCM products and services and building evidence base to support rational and appropriate use, contribute to reaching the unreached NCDs and agings. In other words, we have the vulnerable population, and the vision says that they should not be left behind. So for traditional medicine, I think that they should also have a stronger roles to cover the patient with the NCD, the aged, and also the vulnerables to enjoy strong medical services. So we have to strengthen the competencies of the traditional medicine, and also we have to build an evidence basis. So these are the things that we focus on for the future. Next is about WHO traditional medicine strategy, or what we call global strategy. So again, this is not the final version. It's going to be updated soon. So we are in a sort of the transition period right now. But anyway, so the current strategy was to cover up to 2023, but recently it was extended to 2025. So if you look at the objectives, the first one is to build a knowledge base for active management of TNCM through the appropriate national policies. In other words, the TNCM should be actively embraced within the country's mainstream system. That's why this strategy was developed. The second objective of the strategy is to strengthen the quality assurance, safety, proper use, and effectiveness of TNCM by regulating products, practices, and practitioners. So in Korea, we do have the Korean medicine practitioners, and other countries also have the positions like the healers in some Pacific countries. So we have diverse kinds of the practitioners. And so in using products and practices and practitioners, we make sure that the quality, safety, and the proper use and effectiveness are guaranteed. And for this, the strategy was developed. The third goal is to promote UHC by integrating TNCM services into healthcare service delivery and self-healthcare. So in other words, the traditional medicine and also substances that are important, but also the human interactions as well as the techniques and practices that could happen in the process of providing traditional medicine service. They should also be integrated into the healthcare service delivery system in order to achieve the universal health coverage. Now, this is the new strategy that we are going to announce soon, and it's still in a draft version. So it was under public consultation in April this year to receive the feedback, and everyone can actually contribute through the internet. And then we had the first version in June, and for that June version, again, we received the feedbacks from the representatives of different countries to be updated in August. And the former version of this new strategy will be published in year 2025 and become effective from that year. But here, if you look at the objectives and the overall directions, they remain pretty unchanged. And I don't think the domain itself will be changed. So the strategic objectives and directions, if you look at them, so it defines the stakeholders, so like government or the public sectors and representatives or the non-government actors, and what kind of actions they take, and also the WHO, what kind of action they should take. So they divide the roles that should be played by these different stakeholders. So the first objective is to optimize the cross-sector value of TCIM or traditional complementary and integrative medicine and empower communities through inclusive approaches. So that's the first objective. So this means that TCIM should not just rely on the resources inside, rather they should be linked with the other disciplines in order to provide a more and broader contributions to the society. And what WHO focuses on, so that's the health and well-being society, One Health, and also the SDG or Sustainable Development Goals. So these are sort of the universal values that all humanity should work hard to achieve, and TCIM should be part of the solutions to achieving them. In other words, WHO claims for the multidiscipline activities that include TCIM. And also there are some folk medicines and knowledges of the folk medicine that are passed down for generations in various countries. So these are sort of the indigenous medicines that utilize the indigenous herbs and also practices of healing, and they should not be disregarded. And their patent or the intellectual property rights should not be disregarded, and they should be preserved well. And next is about the safety and efficacy improvement. So for those who use the TCIM, their knowledge and skill should be improved, and WHO will make some efforts to improve that. Now, if you move on to the second goal, is that's the strengthen the evidence basis for TCIM. And for this, first of all, they said that we have to increase resource investment. In other words, countries should more aggressively allocate budget in order to develop the evidence basis for TCIM. And second is about the research approach. So it says that the rational utilization of technology. So science technologies have developed leaps and bounds, and ChatGPT has become part of our day-to-day lives. And with this scientific development, we make sure that the TCIM will not be neglected. Rather, they will be actively embraced. And also, the benefits of TCIM should be expanded to benefit more patients. Now, the third goal is to support the provision of quality and safe TCIM through appropriate regulatory mechanisms. So this is about regulation. So in order to ensure safety and quality, the Korean government works very hard. And compared to the Western Pacific countries, I believe Korea is almost at the top for the regulatory competencies. But not all countries do have such strong regulatory competencies. So we make sure that countries in other areas should also have a sufficient regulatory competency in order to guarantee quality and safety of TCIM. So for this, it specifies the two goals. The first one is about the TCIM product, and second goal is about TCIM practice and practitioners. And the fourth goal is about integration. So how we can integrate the TCIM as a part of the health system. And this is to achieve UHC. So through this incorporation of TCIM into national or subnational health-related framework and policies, we can promote strong cooperation among member countries and with different organizations. So the first goal under 4 is to incorporate TCIM into national and subnational health-related frameworks and policies. For the integration of safe and effective TNCM into the health system. And the second goal is to facilitate the integration of safe and effective TNCM into health system and services across the care continuum and life course. So in other words, if you look at the cycle of the clinical interventions and the cycle of people's life, TNCM should be utilized throughout these cycles. So far I have talked about the global strategies. So the global strategies are set by WHO at the global level, whereas this one refers to the Western Pacific specific regional framework. So this is a regional framework focusing on Western Pacific area. So it was endorsed in 2021, and now we are in year 2024. And the goal of this document and also the vision it's pretty much same as the one before. So I will just go to the strategic actions. So let me delve into this. So here you can see issues, strategic actions, and priority actions. So that's on the vertical side. And green box If you look at issues in green box, this is about role and value of TNCM. In other words, the TCIM should be part of the national policy. And when it comes to safety and quality, the focus is on regulatory mechanism. And for access to TNCM service, so this is to expand the access for TNCM services. And then finally, we have the evidence or the evidence for documentations. So evidence-based Korean medicine, I believe this is something that we are very familiar with. So if you go to the e-commerce booth, there are many booths that talk about the evidence basis. So this is a very common concept in Korean medicine context. But if you go to some countries for the traditional medicine and also herbs and practices, they're not really properly documented. So let alone evidence basis. Even the documentation is not sufficient for these countries. So we do have pretty wide diversities on this issue. So evidence generation through research, of course, that's a very notable goal. But if it's not the pragmatic goal in a country, that at least they should work on documentation. So here you see that the countries in the Western Pacific through documentation and by building evidence, they can contribute to the overall improvement of health situations in Western Pacific. Next, if you go to the strategic action level, you can see that Korea, we also have a policy to promote Korean medicine, but there are some countries who don't have such policies. So for these countries, the policies should be developed so that the public sector can earmark the budget for the promotion of the traditional medicine. And so that all starts with the policies, but some countries, they don't really have the capacity for doing so. So for this, the WHO provides technical assistance. And also, rather than focusing on short-term treatment episode, the investment should be made for the full life cycle consideration. And also consumer education and support should be made as a part of the strategic actions. So this is something that we work on at the regional office level. And for the regulation, we have the provide registration and regulation practices. And I believe that Korea has been a role model for this sectors. But if you go to some countries, the traditional medicine practitioner, they don't have the formal license, and some countries do not have the statistics. So legislation basis should be formed for these countries, and for this we again provide assistance. And as for the access, so this is about the system and service delivery design, and also to create environment that enhances the practice of TNCM. And also it focuses on the primary healthcare. So we first focus on primary healthcare. But if you go to Korea, in fact, the tertiary healthcare centers, they also embrace the traditional medicine. And when we talk about Korea's situation, some countries are amazed. And they said that they want to see the model with their own eyes and what kind of regulations Korea does have. So they're pretty interested in Korea's best practice. So maybe Korea's practices can be shared through the WHO. And as for the evidence, as I said, so it should start with the documentation and dissemination of evidence, and evidence generation should be done through research, especially focusing on safety and effectiveness. So far I have talked about a lot of documents like global strategies, regional and regional visions. And with these, let's take a look at how countries are implementing these visions. So in order to address this, we have recently engaged in this activity that based on the regional framework that was already established, we looked at the 37 countries in Western Pacific and how they promote the traditional medicine within the regional framework. So we invited the representative of different countries. So the member states, and we did the advisory board meeting here in Seoul. So they actually provided a very valuable feedback through that meeting. Before I talk about their feedback, let's take a look at some photos. So here you see that the representative of the different countries participate, and can you feel the vibe of that event? So this is the session called World Cafe. So there is a rule in this session that we play the BTS music, and when the music is on, the representatives have to dance to the music. And then when the music stopped, then they have to sit at the nearby table. And then they should start discussion with the neighbors on the table. Anyway, so it was really exciting and very fun. At the beginning, I talked about why we are gathered here. So rather than each country fighting alone, um, we make the collective commitment and efforts. And when we are together, there are a lot of benefits. So here you see what kind of benefits we can have when we explore shared priorities and how we can do that. So we have a member state consultation meeting to explore shared priorities. And there are several points that were raised in that meeting. The first one is about terminology. So in fact, the terminology should be harmonized. So we have the terms like traditional medicine or traditional complementary medicine or traditional complementary and integrated medicine. And I think that this actually reflects the reality um, where the traditional medicine is referred with diverse terms. So some countries use the term like integrative medicine, others use TCIM or traditional medicine. So again, these terms should be harmonized. That was the first thing that we talked about. And second, through the regulatory competencies, we can enhance safety, quality, and effectiveness. And it was generally agreed that the safety and quality control is a critical part for the integrated healthcare. In other words, the traditional medicine should have sufficient regulatory competency. But if you move to the point three, when applying these regulations, for example, like the Pacific Island nations, they are short on the basic healthcare systems. And also, they don't have strong regulation for traditional medicine. So with the poor infrastructure and system, but they have very strong culture on traditional medicine. So it's not right to provide excessive regulations to them. So that's why the contextualization, the concept came out. So in other words, we have to apply regulations depending on the context. And this is a very, very critical issue. And WHO, when implementing and planning for the regulations, again, coordinating and collecting the feedbacks and opinions from different countries are very important. So in fact, it's very hard for us to come up with sort of the one-size-fits-all answer. So again, we have to have a continuous discussions in dialogue with them. And next one is about the reaching the unreached and the cost effectiveness and also promoting UHC. So, and we found that the countries do want these goals, especially in the primary health environment. There is a consensus that the countries put a lot of importance on these goals. And before I said that there are diverse stakeholders like government actors, non-government actors, and also international organizations like WHO. And each stakeholder has different role to play. So how can we harmonize these activities? Again, this is another important area that we have to work hard. And WHO's role is to coordinate different perspectives regarding this. This is my final slide. So this is my suggestion. So Korea does have a lot of best practice and very advanced systems. And other countries are interested in Korea's practices, and they also want to emulate the advancements that Korea has achieved. However, as I said at the outset, system is not something that can be achieved overnight, but it should be established one day. So we have to have a long-term perspective. And also for specific clinical conditions, diseases, treatment, or medicines, again, we have to conduct research. Not just the researches on the general environment, and especially what kind of contributions the traditional medicine can make to achieve UHC. So we have to have some research progresses that can answer these questions. And also, if you go to PubMed, you don't really have the list of researches that provide answer to this question. So the keywords in the title, I believe there must be more title keywords like the UHC, PHC, SDG. So when you write down the papers, please use these keywords more frequently so that we can build stronger evidence that the traditional medicine does have a very important role to achieve UHC. And second is about joint mission. In other words, we have to establish a team. So inside the Korean medicine, yes, so far we have done a lot. We have established a lot of joint committees or the teams, but what we need in the future is a more diverse teams that brings together people from different disciplines. So Dr. Wang talked about the at-home care, and so we have a lot of like integrated at-home care to respond to the demographic aging and societal issues. And we also have various medical interventions and so on. So I believe that we really have to establish a team of people from different backgrounds. So you have done a great job, but I hope that more and more countries and regions can create this kind of researches and examples. Last but not least, so real world. Here, I intentionally use the term real world cases rather than RWD or the real world data. RWD, I think, is very hot across the world. It's very, very trendy word, but it's a very common approach. But as you know, we have a lot of digital technologies. For example, Like through the application, you can check how imbalanced your body shape is. And these technologies are something that are very new to some countries or even unimaginable. And therefore, yes, defining methodology for real world data, that's important. But I think that we also have to think about how we can combine these advanced technologies into the traditional medicine. And for this, I think more and more real world cases rather than data cases should be presented. So this is my final slide, and this is the WHO vision and mission. So WHO's vision is to make the world safe and healthy, and our mission is to promote health and to keep the world safe and serve the vulnerable with a measurable impact for people at country level. So these are the missions and keywords that we pursue. So far I have talked about the WHO, WPRO, and what we work on for the traditional medicine. And thank you very much for your attention. So this will conclude my presentation. And here is my email address. So if you need, please send me an email. Thank you very much.
네, 한은경 박사님 감사합니다. WHO
Thank you so much. And she has been giving us the global strategy of WHO along with the current status in the Eastern Islands. And also, she gave us a lot of suggestions so that we can take them by heart. Thank you very much. And moving on, we have our fourth lecture.
Education in Uzbekistan이라는 제목으로 한국 국제협력단의 글로벌 협력 의사로 우즈베키스탄에서 활동하고 계신 송영일 원장님께서 준비해 주셨습니다. Ladies and gentlemen, next speaker, let me invite Dr. Young-il Song, Global Director at KOICA. 여러분 큰 박수로 송영일 원장님 무대 위로 모시겠습니다.
Very nice to see you, ladies and gentlemen. It's my honor to be able to speak before you today. My thanks should go to the MOHW and NICOM. I am a Korean medicine doctor. In Uzbekistan, including myself, we have one more traditional medicine doctor in Uzbekistan as Koreans. As the Korean traditional medical doctors in Uzbekistan, you don't have to take any test in order to be certified. So you don't really have other issues of registering yourself in Uzbekistan as Korean medicine doctor. It was 2003 when I was licensed in Uzbekistan. It has been like 11 years and 6 months since I've been working in Uzbekistan. It is actually longer than my career in Korea as a doctor. Sometimes I am confused with my identity. Am I Korean doctor or Uzbek doctor? And I think that I'm staying a little bit longer for my practice in this country. KOICAM global system is active in this country in order to perform our Korean traditional medicine, or KM, for our patients. The traditional medicine is my practice where I am being designated as a person working in the center. In this way, I am contributing to the cooperation between Korea and Uzbekistan. And Uzbekistan people want to know more about Korean medicine. Maybe I can teach them how to make the Korean medicine, decoction, and many others. I'm also telling them how we can do the curriculum for the educational programs. So we are working with other professionals in Uzbekistan. What I'm going to give you today is as follows. In Uzbekistan, what kind of activity is being made in traditional medicine? So they seem to be very on the ground and localized, but I really hope that they can be helpful to you. In addition to Uzbekistan, I'm covering the whole Central Asia. In order to work as a traditional medicine doctor in the Central Asia, you have to know three things. First of all, you have to know this person, Ubusina. And the secondly, you have to be familiar with the religion, and also sometimes it requires you to be open-minded to different religions. The third one is the writings written by Ibn. This can be a collection of books. In the 15th century already, they made fame at that time, being copied and researched in the rest of Europe even then. So as you see here in Uzbekistan, he had the rebirth. Actually, he was born in 1980. And then he had a lot of movement by the military. And later in his lifetime, he spent time in Iran. So Abu Ibn Sina is actually a very respected personality in the history of Central Asia. So you have to know who this person is, Abu Ali ibn Sina. That is quite related to the Korean traditional medicine, I believe, so we can have a link between them. So if you let us know more stories about the relations, you can open the minds of other people as well. So you have a lot to tell about these relationships. These pictures represent the books written by Ibn Sina. They are not translated into Korean yet, but they are in the Chinese language or in Japanese. So I have the red box here. You see, that's the price of the books for 5 editions. You have to pay more than $1,000. It's quite expensive. But in Asia, in Japan, or China, they have done the translation already for their studies and researches. Between Korea and Uzbekistan, in terms of the traditional medicine, more than any other countries, we have advanced relationships and cooperation. I believe that, having said that, we can add our cooperation more working on the Ibn Sina works. So I regret that we should have done more about the researches on Ibn Sina. Professor Kakima Amri is a very renowned researcher in Abyssinia, and she wrote her books about him, and I had a chance to meet with her. So our discussions included our future projects in Korea. So her intention was to help us to know more about Abyssinia and future works. As of now, in Uzbekistan in 2018 and earlier than that, traditional medicine was not fully recognized at the governmental level because they had the legacies of the socialist country even after the liberation. They had to maintain the socialist system in a way, but as for the traditional medicine, they haven't taught at all at the educational facilities. They didn't actually care about traditional medicine at all. However, things changed in 2018. The current president, when he took power, he had the ordinance on the traditional medicine. That presidential ordinance became a hot topic at that time. We tried to uncover inactive areas for the traditional medicine, so that became a trigger point for the traditional medicine doctors to be very active afterwards. The law and ordinance itself is about how we can activate traditional medicines. Therefore, since then on, traditional medicine in Uzbekistan has been recognized and included into the national development framework. Along with that, all the educational facilities, including the medical schools, had to open traditional medicine departments. Therefore, it was kind of big bang. So all at once, all the departments for traditional medicine were created. So just in one day, I think it was right thing to do. However, that caused a lot of turbulences because in a way, Uzbekistan didn't have the readiness to accommodate all this. They didn't have any medical doctors in that, but they had to create the departments and they enrolled many students at a time, so that caused a lot of problems in itself. But I was the Korean traditional medicine before coming there, so before 2018, they asked me to come to their schools to teach, and they said that I was in need and also I was in demand. So I was solicited by all the schools here actually. So this list is all the teaching institutions that where I've been to teach. So I have my experiences of teaching there even today. So I visit all the schools like these. Also in 2020, that president again declared a presidential decree once again that was about creating a center responsible for traditional medicine. So Professor Miro Rapni that we met yesterday was the director of this center in charge of all these activities. So MOHW sent their people to have discussions with them, and all the related organizations related to the traditional medicine sent their people there. Not just Korea, they want to have the relations with all other activities coming from the Asian countries like Japan and China. So they have all the meetings there. Every time we had a visit from other countries, they found that there was someone Korean as an official staff member here in the center, so that might cause some jealousy among them. So in a way, I am proud to say that I have been there already. So that's the future that lies ahead. So in a way, I believe that for the development of traditional medicine education, we need more things like these. This is the list of this curriculum for the students under traditional medicine department. The red words are about the regular special programs for the traditional medicines. All others are regular and common curriculum. It means that they have to finish and complete regular programs before coming to the traditional medicine education. So they have to do both. That's a particular characteristics in here. In Uzbekistan, they have 4 years for the program of the medical schools, which is relatively shorter than regular medical schools in other countries. So what I feel is that maybe these 4 years are not long enough. So we have students for 4 years, but maybe we can lengthen the period of studying in the future. Also, the issue here is that each school has the department of the traditional medicine, as I said, but there should be more facilities for the clinical trials, as we call it, traditional medicine hospitals in Korea, but we do not have them a lot in Uzbekistan. Therefore, even students finish their schools, they don't have anywhere to go for clinical practices. So sometimes they had to teach themselves by reading books. So their wish is to go to see more patients in the centers after graduation of the schools. So that's the wish we would like to have more facilities for the practices when we have the relations and agreements with the counterparts in Korea. So that's my wish that I want to let known. We have the undergraduate programs only. We do not have any graduate school programs, or we do not have any degree programs for the doctors. So in order to obtain master's and doctoral degrees, therefore, in traditional medicine, many students should go to other countries. So we do not have those further educational programs. So we had to send our students to other countries like Korea. But we have a lot of students who wish to become doctors, medical doctors in the traditional medicine. Therefore, my another wish in the future is to have the programs available for the masters or above, so that they can learn more. For example, in Korea, they can go back to Uzbekistan after finishing their doctoral programs, so that further development can be made. Another thing, in Uzbekistan, it was 1995 when we first sent our traditional medicine doctors to that country, because we had the agreement of a friendly visit of Korea to Uzbekistan. We have the record kept here. And Korean Medicine Hospital was established to treat the patients. That hospital in itself was free of charge. Therefore, it was crowded by so many patients. In a way, it's good to be free, but we had too much crowdedness of the patients, so we had issues with the scheduling. That's why we made it fee-based now, so it's not free anymore. So there is a forte here, because by charging, we can say that we are fully recognized by the government, so that we charge our services and we can be incorporated in their national medical systems. So we can say proudly that traditional medicine, especially KM, Korean medicine, has been recognized officially by the government of Uzbekistan. So I am there from 1995 and 2007, and also we had our predecessor who was there, who was working for the KOICA, and so KOICA dispatched many doctors. I am very thankful for their dispatches and the services in Uzbekistan. So I'm very happy to say that we have seen great achievements so far. There's a saying that in the traditional medicine community, that medicine doctors do not make a lot of money, because acupunctures and the prescriptions, especially in Uzbekistan, are very difficult to be imported. So if you try, you will know. So if you bring your decoctions and acupunctures and many other equipment at the customs, you always get caught, and you have to pay for this equipment before being released. And also another thing particular here is that there's no production going on for the needles in Uzbekistan. So they are importing, but we call it smuggling. So most of them are being smuggled into Uzbekistan. So they are being imported as if they are in the smuggling. So the needles made in Korea actually are a great demand in Uzbekistan nowadays. And people working for the clearance are complaining that why people really need needles this much. But in a way, I can interpret that remark as a big demand of the acupuncture of the patients in Uzbekistan. I really see an increasing and mushrooming demand. That's what's happening at the customs. Another thing, for the medical fees, it is very difficult to charge and be reimbursed by the Uzbek government. Prices are different between Uzbekistan and Korea. But we can utilize this difference of prices so that we can expand our coverage of the traditional medicines. but then again, it will backfire at the customs once again later. So there is a chain of problems. Therefore, so far we've been experiencing challenges and difficulties in this way. Nevertheless, although we had a lot of trials and errors, I can tell you that we have a lot of popularity of Korean traditional medicine in Uzbekistan. We also have Korean medicine textbooks in Uzbek language. These books and textbooks are being distributed free of charge to the medical institutions in Uzbekistan. Students are learning Korean medicine with these textbooks. Now we are helping them to do that. So we had the support from NICOM as well. And we are seeing great success so far. And we can see in each of the medical schools, traditional medicine, including Korean medicine, they had the test, and in the test they had the questions about the saam, needling, and the four type constitutions. So Sasang and Saam were included in their questions. That was very interesting to see that. Even though you don't know the Uzbek language, you will be able to find the word Saam and Sasang in the red boxes. So it means that they have been this popular and this meaningful, and they should be memorized by the students. So it means that all the students are already aware of this ham and sasang, although their level of understanding is not that deep. So I captured the picture of the questions of the test in order to show you how popular Korean medicine out of the traditional medicines. These are the pictures of the students who are studying the traditional medicine. Because of the high demand, we had to open classes during vacation because we cannot accommodate all of them during the semesters. So we agreed to open a course for the students during vacation, and we got the approval from my boss. Also, the government of Uzbekistan allowed it to happen. For 1 month, we had this special class like this. During that month, Korean students were learning not only traditional medicine, but also things about Korea. So they had the better impression about Korea, and also their dreams have been seeded. Some of them expressed their wishes to come to Korea for their further studies. So I believe that this is one of the good effects of the classes, and I look forward to having more good results in the future. While making this presentation material, I was benefited by Professor Che Am of Busan National University. He was guiding me a lot for making this presentation available for you. Thank you very much for listening. Thank you so much. Q&A slide is on now. We will entertain the questions after all these presentations are completed. We have been learning about the past, present, and future of traditional medicine education in Uzbekistan. Thank you very much.
소개하게 되었습니다. 마지막 발표는 한의사의 캐나다 진출과 최신 동향, 브리티시 컬럼비아주 면허제도와 한의원을 중심으로라는 제목으로 서울특별시 한의사회 의료기기 위원회 이하림 위원님께서 발표해 주시겠습니다. Ladies and gentlemen, we have now reached the final presentation of the session. The presentation titled Korean Medicine Doctors' Entry into Canada and the Latest Trend, focusing on the state licensing system in Korean medicine clinics, will be delivered by Dr. Harim Lee, member of Medical Device Committee, Seoul Korean Medicine Association Medical Device Committee. 여러분, 큰 박수 부탁드리겠습니다. 안녕하십니까.
Yes, so good morning. I am the member of the Medical Device Committee at Seoul Korean Medicine Association. I am Iharim, and I'm standing between you and lunch, so I will shorten my presentation as much as possible.
Gratitude to ICOM for giving me this opportunity to present about Korean medicine doctors' entry into Canada and the latest trends, especially in British Columbia. Starting from Canada's healthcare system overview, I'm going to go through broad skimming about how popular, efficient it is to work as a Korean medicine doctor in Canada and how to do so. Next, we're going to go through some example clinics who have successfully settled and functioning as successful primary healthcare agents. So Canada's healthcare system works in conjunction with regional health care system in 10 states and 3 regions, and the order of use of medical services is set by type. In primary care, which consists of most acupuncturists in Canada, there are family physicians and GP, community health centers, and nurse practitioners. So the first group, these providers are often the main point of contact for patients and coordinate overall care. Community health centers, these facilities offer a range of primary care services and often use interdisciplinary terms. And nurse practitioners in many regions, they provide primary care services, especially in undeserved areas. Unlike primary health care, secondary services include specialists and hospitals, and there are also supplementary services, and some acupuncturists also can be included in this group. According to OECD report, Canada has relatively higher healthcare expenditure but indicates a comparatively lower portion of direct household spending on healthcare. In Canada, the ratio of current healthcare expenditures to GDP is 12.2%, representing 1.38 times the OECD average, which is 8.8. However, the direct household contribution to current medical expenses in Canada is 14.7, which is 74.2 of the OECD average of 19.8. So this indicates a comparatively lower portion of direct household spending on healthcare. Unlike universal coverage, the conventional medical services, the regulation and integration of TCM and acupuncture varies across Canada. There is nationwide regulation, but there are also provincial regulations, and each regions have different provincial regulation and protected titles. So it is crucial for you to actually identify which are the protected titles, such as RAC, RTCMP, and British Columbia. And then understand what kind of licensing requirements you need for practitioner. So increasing medical tourism in Canada, from Canada to South Korea, and global growth to alternative medicine market. Also, these two statistics show how popular it actually can be in the future. Increasing of the medical tourism from Canada to South Korea. So in 2023, around 9,400 medical tourists from Canada actually travel from South Korea for medical treatments. And the global alternative medicine market is projected to grow significantly from about 40 billion in 2015 to 196.8 billion by 2025. This graph shows the status of reporting on overseas expansion by medical specialty. As you can see here, Korean medicine ranks third after dermatology and dentistry among clinical level institutions, excluding general hospitals. This confirms the potential for the overseas expansion in Korean medicine. And this one shows the status of reporting the overseas expansion of medical institutions. In 2022, the number of reports reached actually 37. Also, by 2022, the cumulative number reached 162. So your CCHPBC, which is former CTCMA, license indicates you are a regulated healthcare professional in BC, which gives you your practice a level of recognition within the healthcare system. While you operate independently, you may still interact with other parts of the healthcare system, such as osteopathy, through the referrals of or collaborative care plans. British Columbia's insurance policy demonstrates a positive attitude towards acupuncture. As you can see, these insurance policies are expanding the coverage within the number of sessions and variety of treatments. The inclusion of acupuncture in various insurance plans reflects growing acceptance of this traditional treatment. This supportive environment and the atmosphere enhances accessibility and recognition of acupuncture's potential benefits in BC's healthcare system. Now let's see the requirements. You'll need to obtain the appropriate work permits or permanent residency status to legally work in Canada. The specific type of permit may depend on your situation. Also, your foreign medical credentials will need to be evaluated and recognized in Canada. But you'll be okay if you're Korean medicine here. 한의사시면 다 괜찮습니다. You may need to complete additional training or examinations to meet Canadian standards. And licensing process, have your Korean medicine education and credentials assessed by the ICES. I'm gonna say this more in detail later, or similar organization recognized by CCHPBC. Lastly, familiarize yourself with Canada healthcare regulations and business practice, which may differ from those in Korea. Let's look through a specific licensing process for KM doctors obtaining acupuncturist license. First, submit transcripts and degree certificates from your university directly or graduate school directly to the designated credential evaluation agency. This process typically takes a minimum of 4 weeks. And then review examination information and regulations from the regulatory board of the province where you are applying. I'm just giving an example for the British Columbia. And then undertake the required licensing examinations. After passing the examination, all you need to do is issuing your license. These are the key changes this year. I used both CTCMA and CCHPBC in my presentation and these program books you have given. This is because as of June 28, this year, the College of Traditional Chinese Medicine Practitioners and Acupuncturists of BC, that was CTCMA, has been amalgamated into the new College of Complementary Healthcare Professionals of BC. Sorry, that's CCHPBC. They they still have the CPR program, but they actually reduced admitting certification issued by some Korean organizations. So make sure to double check. The refresher program is the most crucial change this year. So if you graduated from TCM education program for more than 3 years, you are required to complete a refresher program and course. There are 3 examples of the clinics. From the left, there are Fitness OMC, and there's Fifth Avenue Therapeutic Massage and Acupuncture Clinic, and Yaletown Wellness. These are 3 Vancouver leading clinics that have actually successfully sold and functioning as primary healthcare agents. As you can see, they are not only providing various medical care, they also crucially function as primary healthcare agents for Canadian. Also, they have leading KM practice overseas and showing how wonderful Korean medicine is. These are slightly different clinics. They combine this KM with beauty, kind of. Yeah, this is not actually healthcare. They usually practice as laser and beauty care, but you can also see this kind of face of Korean medicine through these in Spirit, Boda, and Electra Health. Last but not least, there are still challenges and considerations in regulatory disparities, public awareness, and integration efforts. However, for expansion of Korean medicine, these obstacles are only to overcome. And that's it for me, and thank you for listening.
네, 이하림 의원님 발표.
Thank you very much, Dr. Lee. We have listened to 5 presenters for the morning, and now is the time for us to have our questions and answers. So for any of these 5 speakers, if you have any questions, please raise your hand.
If you have a question, please raise your hand and we're going to hand over the microphone. 네, 여기 제일 앞에 계신
On the front row, we have a question from Ms. Laila, who's our speaker.
I'd like to ask Ms. Halim Lee. Yeah, hi. So thank you for the very informative presentation. My question is, do graduates of local Canadians from the academic institutions, so the graduates of Canada, Canadians, do they require examinations for licensing to practice in Canada?
Thank you for the question. Yes, they need to take the same tests, and also they need this certain degree in order actually to take the test.
Great, thank you.
네, 그리고 학생분께서 손 들어
So we have a student who also has a question. Maybe not student.
Far left, please, from my side. Why don't you just stand up a little and please identify yourself, and you have to tell us who your questions go to.
Sangji University, and I'm majoring in Korean medicine. And I have a question for Dr. Eamon Maad. Did I pronounce it right? Thank you. First of all, I would like to ask if factors such as nationality, the medical school you attended, and gender are taken into serious consideration when it comes to hiring acupuncturists from foreign countries. Are there any preferences based on these criteria? And also, in your opinion, what are the advantages of a Korean acupuncturist obtaining an acupuncture license in Washington State or other countries instead of California? Thank you.
Sure. So there's a list of accredited schools, foreign schools. If you're a graduate of these schools, then you qualify to go through the pathway. But there's some schools like, I'm not sure about Korea, probably like in China, there are some schools that they're not accredited. They may not be accredited, or in some other countries they may not be accredited. So if you're a graduate from those schools, you will not be recognized. Your education will not be recognized in US, so you do not qualify to go through the pathway. You have to go back to school in US. So that's the starting point of it. What I've seen is that traditional Chinese medicine, well, in a sense, Korean medicine actually, it's becoming quite popular. Earlier this year, I had an invitation from the Korean Acupotomy Society, and I did a presentation for them, and it seems like it's growing, especially in Washington State. In Washington State, we have a relatively decent, large size of Korean population, so I'm sure that they would welcome to have more Korean practitioners there. In regards to getting licensed in Washington State compared to other states, Washington State is relatively liberal. So we welcome other practitioners. There are some states like Texas, in southern states, they're more restrictive, so they have more regulations. It might be a little bit more difficult. California has its own board exam, so they don't recognize NCCOM. If somebody wants to practice in California, they have to go through the whole California board exam and regulations for California. And getting a license in California does not translate anywhere else. So if you get a license in California, you do the board exam in California, you stay in California. If you want to move out of California, then you have to go through NCCOM and other routes. So at the legislative level, we have been trying to work with California, so California would adopt NCCOM, and they haven't yet. But who knows what's going to happen in 5 years.
Thank you, sir.
Sure.
Thank you very much. Thank you very much for your detailed answer, Dr. Yeman Majid. 네, 그럼 여러분 시간 관계상 한 분 정도만 더.
Because of the time constraint, we can entertain only one more question. Do we have any question from the floor? Yes. Well, thank you very much for helping me with my time management. With that, I'd like to end the morning session, which is session number 3 of 2024 International Symposium on Traditional Medicine. We will have 60-minute lunch hour, and we'll see you again after lunch.
Have a lunch break, which will last for about 60 minutes, and we look forward to seeing all of you back in this hall at 1:30. 네, 그리고 점심 식사는 리조트 내 식당에서 밀쿠폰을 사용해 하실 수 있습니다. 밀쿠폰 뒷면에 이용 가능 식당 리스트를 먼저 확인하시고요. 해당 식당에 밀쿠폰을 제출하시고 이용하시면 되겠습니다. Please refer to the restaurant on the back of the meal coupon for lunch. And to enjoy your meal, please present the meal coupon to the restaurant for the redemption. 네, 연사분들께서는 오늘 오찬 장소로 함께 이동하기 위해서 이곳 홀 내부에 잠시 모여 계셔 주시면 감사하겠습니다. Distinguished speakers, please stay and gather in this hall, and we're going to move to the luncheon venue all together. Thank you very much. 네, 그럼 저희는 오후 1시 반에 여기 홀에서 다시 뵙겠습니다. We look forward to seeing all of you back in this hall at 1:30. Enjoy your lunch.